Ladies and gentlemen, please stand by. Your webinar is about to begin. Please use the volume control on your computer or phone to adjust the sound for this presentation. Good day, and welcome everybody to the Canadian Obesity Network webinar series. Today's presentation is Public Health Failing People with Obesity. My name is Nicole Christensen for the Canadian Obesity Network, and I will be hosting today's webinar. This public webinar series is an exciting opportunity for the Canadian Obesity Network to interact with Canadians to disseminate credible and evidence-based information about obesity. Through this platform, experts will weigh in on issues in obesity bias and discrimination, prevention, treatment, policy, and more. If you'd like to be a part of our public community and want to be the first to hear about future webinars, please become a member at obesitynetwork.ca/public and opt in for our newsletter. An archive of this webinar will be posted and available for viewing on the obesitynetwork.ca/webinars page. Due to the extremely high volume of requests to join this presentation, we have disabled microphone and question and answer features. However, we do want to answer any questions you might have. So if you have any questions you'd like to ask the speaker, you may do so via social media or in the evaluation survey at the end of this presentation. Now I'd like to introduce Dr. Ximena Ramos Salas, Managing Director of the Canadian Obesity Network at the University of Alberta in Edmonton. Dr. Ramos Salas' research explores the unintended consequences of obesity prevention policies for people with obesity. Her goal is to spark solutions that will prevent the perpetuation of weight bias, obesity stigma, and create more effective population health approaches. Ximena is also an expert consult with the World Health Organization Regional Office for Europe, where she provides technical and strategic support for the Nutrition, Physical Activity, and Obesity program. And I'd also like to introduce Dr. Sara Kirk. She's a professor of health promotion in the School of Health and Human Performance and the scientific director of Healthy Populations Institute. She holds cross appointments with community health and epidemiology and the IWK Health Center. Is an adjunct professor at Mount St. Vincent University in the Department of Applied Human Nutrition and an honorary senior scientist with the Beatrice Hunter Cancer Research Institute. Dr. Kirk explores how we can create supportive environments for chronic disease prevention. Her research also uses a socio-ecological approach that considers how individuals' behavior is influenced by other broader factors such as income, education, and societal norms. Now I'd like to hand it over.
Thank you, Nicole, for that introduction. So the focus of this webinar is on public health and obesity prevention. And as you may see, other webinars in this series approach obesity narratives from other perspectives, including basic science and clinical practice. So we encourage viewers to watch those webinars as well, because there are a lot of connections between these obesity narratives. So my presentation today will focus on the unintended consequences of the current obesity prevention narratives on individuals living with obesity. And specifically, I argue that current narratives in obesity prevention may contribute to weight bias and obesity stigma. Sara will extend that discussion to provide examples of the ways we can shift the dominant narrative away from focus on weight and towards health and well-being for everybody through the application of a broader socio-ecological lens. So let me start by defining some of the key concepts so that we can all start from the same frame of mind as we go through this presentation. So, weight bias refers to our personal negative attitudes and beliefs that we have about obesity and about people with obesity. Weight stigma, on the other hand, refers to the social stereotypes and misconceptions that we have about people with obesity. These stereotypes and misconceptions are deeply rooted in our society, and they include stereotypes such as people with obesity are lazy, awkward, sloppy, non-compliant, unintelligent, unsuccessful, and lacking self-discipline or self-control. Finally, weight-based discrimination refers to actions against people with obesity, and this is when we enact our personal biases and the social stereotypes about obesity and actually do something against people with obesity, such as bullying, physical abuse, and social exclusion. All of these concepts, I tend to think about them as interrelated. Weight bias can lead to social stigma, and stigma can lead to discrimination. Now, from a public health perspective, why does stigma matter? Well, we have decades of research that show that stigma is common and affects large portions of the population. There are many stigmatized conditions such as HIV/AIDS, mental illness, and other chronic diseases, including obesity. Our studies show that stigma impacts health and social outcomes such as housing, employment, income, social relationships, psychosocial or behavioral responses, healthcare access, as well as overall morbidity and mortality. And overall, research shows that stigma can be an added burden that affects individuals above and beyond any impairment they may have because of their condition. So, from a public health perspective, weight bias and weight-based discrimination, we know that they're quite pervasive in our society. The Red Center for Food Policy and Obesity has measured the prevalence of weight bias and weight-based discrimination. And these studies show that 63% of children with obesity who attend elementary schools, for example, face higher risk of being bullied by peers. And 54% of adults with obesity report being stigmatized in their workplace, while 64% of adults with obesity also report experiencing weight bias from healthcare professionals. And as you all know, the media tends to portray obesity and individuals living with obesity in a very negative way. So there are many consequences of weight bias and stigma. In this model, you can see weight bias and stigma can result in increased morbidity and mortality by affecting individuals' health as well as by influencing public health policies that may increase health and social inequalities. At the individual level, experiences of weight bias and stigma can lead to unhealthy eating and reduced physical activity, increased risk for psychosocial disorders, produce stress-induced pathophysiology that can actually increase obesity risk, and lead to access issues in the healthcare system. At the population level, weight bias and stigma can lead to the lack of comprehensive obesity strategies, limited obesity prevention efforts, which can actually also produce health and social inequalities. So there are many ways that stigma operates, and it can operate in a very overt and direct way, whereby we may openly disrespect individuals with obesity through verbal abuse, bullying, and denial of access to evidence-based healthcare. But stigma can also be operating at an indirect way, whereby the deeply ingrained social stereotypes that we have about obesity prevent us from actually questioning the mistreatment of persons with obesity. So the lack of action or not questioning weight bias attitudes and stigmatizing behaviors makes obesity a kind of socially acceptable prejudice. And at the structural level, stigma can also create barriers and produce inequalities for individuals with obesity. For example, when we see the lack of accommodations for persons with obesity in hospitals or schools. Now, I have been working in the field of obesity for over 15 years, and through my work at the Canadian Obesity Network, the issue of weight bias and its impact on policies became a key interest to me. And at the beginning of my doctoral research, I started thinking about, what are some public health strategies that are trying to prevent obesity, and I started seeing some of these strategies out there. And this is an example of these images here from a campaign in the United States. And these images were used in billboards all around the state in Atlanta, Georgia. And this campaign made me wonder, what is going on in obesity prevention public health strategies? This question became kind of the focus of my doctoral research, and I was trying to think about, what are the obesity narratives that are constructed and enacted in public health, and how do people with obesity relate to those public health narratives? And as I started reading the literature on weight bias, I learned that public health strategies have been criticized for promoting weight bias in our society. Specifically, I summarized some of these critiques in a paper in the Canadian Journal of Public Health in 2015. Public health obesity strategies are too focused on individuals' behaviors, and there's a lack of comprehensive strategies to prevent obesity at the population level. I also found that the critiques included that to date, public health interventions have had modest effects on reducing and preventing obesity at the population level. and that public health obesity prevention strategies tend to focus too much on weight rather than health, and that public health obesity prevention strategies are kind of changing body size ideals and causing excessive preoccupation with weight at the population level. So to see how these findings related to the Canadian context, I conducted a review of Canadian public health policies for obesity prevention, and I identified 5 prevailing narratives in the Canadian obesity prevention policies that I consider may be contributing to weight bias in Canada. First, all of these policies tend to focus on childhood obesity, and that allows for the positioning of obesity prevention policies, but also silences the needs of adults living with obesity, as well as the needs for obesity management strategies. These policies tend to also simplify obesity as a healthy eating and exercise issue, and that is a fundamental driver of weight bias attitudes because it ignores all the other factors that impact obesity. Finally, I also saw that when obesity is framed as a social problem, most of these policies do position obesity as a social problem. However, the interventions that are recommended in these policies tend to reinforce the individual responsibility narrative. And then the healthy body weight narrative that was prevalent in all of these policies tends to categorize individuals into the healthy versus the unhealthy weight groups. And this results in the labeling of individuals according to their weight or size, and this can also drive weight bias. In these policies, obesity is seen as a risk factor and not as a chronic disease in itself. And since obesity is not seen as a chronic disease, the policy implications is that there is no need for comprehensive prevention and management strategies to address it. This narrative is kind of at odds with the clinical and scientific narratives of obesity that stipulate that obesity is really a chronic disease that requires long-term support and interventions. And finally, I found that none of these policies engage persons with obesity, nor did they address weight bias or obesity stigma. So I wanted to talk to people living with obesity to see how they related to these public health messages and these policies. And over a period of 2 years, I had many conversations with persons with obesity in places where they lived, worked, and enjoyed leisure activities. And as we discussed the public health obesity prevention narratives and how they relate to those messages, we concluded that public health obesity messages are overly simplistic and do not represent the realities of persons living with obesity. The underlying assumption of these messages is that weight management is easy and individuals should be able to manage their own obesity themselves. Public health messages also tend to put blame on individuals living with obesity by using stigmatizing images and framing healthy eating and physical activity messages as obesity prevention strategies, which implies that people with obesity eat unhealthy and do not exercise. In other words, they do this to themselves. Finally, persons living with obesity thought that public health messages also tend to quantify health in terms of numbers such as BMI and numbers on the scale. And that healthy weight goals that are presented in these public health strategies are not really realistic based on the existing treatments that we have about obesity, and persons with obesity feel that they can never really achieve these numbers and become healthy according to the public health standards. So here are some comments from some of the participants that I spoke with. When I deconstruct this message, it says to me that public health professionals believe I did this to myself, so they don't need to help me find evidence-based treatments. The eat less, move more messages make it sound really simple, doesn't it? But my journey has not been simple. It has been difficult for me. Every day is difficult. Finally, here's another comment from one of the participants. I have lost over 100 pounds, but I'm still obese according to the BMI categories. My goal is to maintain this weight loss. Based on what I am doing now, I cannot eat less and I cannot exercise more. So I will never achieve the healthy weight range promoted through public health campaigns. I am at my best weight and I need to accept that. So what I learned from these discussions is that the fundamental driver of participants' experiences with weight bias is a lack of understanding of obesity. This lack of understanding can be linked to public health narratives that oversimplify obesity as an unhealthy eating and lack of exercise issue. It also leads to social narratives that obesity is a self-inflicted choice and that it is up to individuals with obesity to address their own weight. This lack of understanding in turn can lead people to experiencing weight bias and stigma. The stories I heard reveal that people with obesity are treated differently by their families, friends, co-workers, and even healthcare professionals. And this lack of understanding also leads to how individuals conceptualize their own self. Many internalized the damaged social identities of obesity and felt that they were abnormal, that they did not fit in this world, and that this affected their self-confidence and self-worth. That internalization can impact their emotional responses and trigger feelings of shame, blame, vulnerability, stress, depression, and even suicidal thoughts. In addition, I found that these stories reveal that behavioral responses can also be influenced by weight bias. So people will avoid health-promoting behaviors, they will eat in secrecy, they will isolate themselves for fear of being shamed and blamed for their weight. And these weight bias experiences also hinder their own obesity management strategies and rehabilitation and recovery processes. So when participants share these stories with me, they also talked about how they needed to develop self-compassion and self-acceptance in their lives in order to really recover from these damaged identities that are out there in our society. So to me, the main finding for me is that the current public health narrative of obesity is at odds with the experiences of people with obesity, and this is causing unintended consequences for individuals living with obesity. So what can we do to change this? The Canadian Obesity Network started the Everybody Matters Collaborative, which is an umbrella of weight bias researchers from across the country trying to collaborate on ways to change this in Canada. And we hosted a conference in Edmonton in May 2016, and it was the third Canadian Weight Bias Summit that we've held so far at the Canadian Obesity Network in collaboration with Canadian scientists. And the objective of this third Canadian Weight Bias Summit was really to look at the current evidence and best practices on how to reduce weight bias in the education sector, the healthcare sector, and the policy sector, and to move forward towards consensus on key messages and strategies that we can use to reduce weight bias in Canada. So over 2 days, 42 participants from Canada and the US, including individuals living with obesity, persons who identify as fat, researchers studying weight bias, healthcare professionals working in obesity, and collaborators from government and non-government organizations, as well as industry stakeholders and individuals representing other stigmatized communities and diseases, such as the LGBTQ community, the HIV/AIDS and diabetes and mental illness communities. So on the first day, participants discussed the evidence and reflected on the evidence. And on the second day, they got together and divided into groups according to sectors and came up with key messages and strategies that we can reduce weight bias with. And in the first day, everybody agreed that, all three sectors agreed that there is enough evidence on the prevalence and impact of weight bias and discrimination on individual and population health outcomes, and that it should not be tolerated in education, healthcare, and public policy sectors. In the healthcare sector, participants agreed that obesity should be recognized and treated as a chronic disease. And they also agreed that strategies to reduce weight bias in the healthcare sector can include using people-centered care approaches and enforcing person-first language. In the education sector, however, participants thought that we need to decouple weight and health discussions when trying to promote health promotion programs in schools. Obesity should not be the focus or the hook for health promotion activities in schools, and a key strategy that was recommended was to promote body positivity and diversity in children and youth. In the public policy sector, on the other hand, participants thought that, again, we need to talk about obesity as a chronic disease, and that we need to develop a better definition for obesity and protect against weight-based discrimination using policies. And since we were able to have both critical weight studies researchers and obesity researchers at the summit, we were able to work together and agree that we want to be inclusive in our language and approaches. Participants agreed that we should be clear about the fact that not everyone with a BMI of 30 has obesity. And obesity is a chronic disease. And based on the definition used by the World Health Organization, obesity is classified as a disease only when abnormal or excessive fat affects a person's health. If a person's weight is not affecting their health, then they do not have obesity. And they're just big people, or people living with larger bodies, or people who may identify as themselves as fat persons. This message is very important, and it was raised over and over again in the summit. So we agree that we should be reducing weight bias and stigma for all Canadians. And the bottom line is that Canadians should be treated with respect regardless of their size or weight. We also discussed the need to change the public health narrative and the health narrative, that obesity is not a self-inflicted choice, and that persons with obesity do not choose to have obesity. The narrative, this narrative leads to assumptions that persons with obesity are non-compliant, lack willpower, and do not care about themselves. And this is really rooted in that lack of understanding of obesity amongst healthcare professionals, which can result in that simplified notion of obesity that we just need to tell people to eat less and move more. And so patients really agree that, this fundamental lack of understanding and that message that obesity is a behavioral choice is leading to a lack of respect for people living with obesity. So considering these findings, I'm just going to summarize and end by recommending some key strategies that we can use in public health to avoid those unintended consequences of our simplified obesity narratives. So first of all, we need to recognize in public health that weight bias and stigma are fundamental drivers of population health outcomes, and is a key determinant of health. And public health can monitor and do surveillance studies to measure and to see how weight bias is impacting population health outcomes. And finally, public health should be able to develop interventions to reduce weight bias and stigma at the population level. Finally, I think in public health, we could apply a weight bias lens when we develop public health policies and strategies, just like we use the gender-based analysis lens. We can think about weight bias when we develop these strategies. For example, we can do that by challenging the individual responsibility narrative, consider the complexity of obesity and the lived experiences of people with obesity. We can also challenge the healthy weight narrative and consider the implications of weight bias for people living with obesity, and consider aiming healthy eating and physical activity strategies at the whole population rather than singling out people with obesity, and promote body diversity at the population level. This is something very important that came up at the Weight Bias Summit and came up by every person that I interviewed and that I talked with about, having that level of self-acceptance and focusing on health rather than body size or weight. I also think it's important to use person-first language in public health strategies and policies, just to be consistent with the chronic disease language that we use in other chronic diseases. And I suggest that we can change the portrayal of people with obesity by using more positive images and thereby promoting body diversity in our images and in our campaigns. So now I will ask Dr. Sara Kirk to tell us more about her work and how we can change the narrative to move.
Very much, Ximena, for that excellent overview of weight bias and stigma. And thank you everyone for joining us today. It's great to have this opportunity to share with you some of the work that's been happening to start to change the narrative around how obesity is viewed and managed within society. The evidence is getting stronger and stronger that we need to shift our focus away from simply looking at weight as an indicator towards focusing on health. And I'm going to illustrate with some of the data from my own research program at Dalhousie University, as well as give some examples through the work that Ximena and I are collectively involved in through the Canadian Obesity Network Everybody Matters Collaborative. And this webinar really posed the question, is public health failing people with obesity? Well, in fact, the health system in general is failing people with obesity, I would argue. We know from a pan-Canadian survey of adults that was conducted in around 2011 that the clinical practice guidelines that were set out in 2006 are not consistently being followed by healthcare providers. Last year, the Canadian Obesity Network also published a report card which starkly outlines the lack of support that's available for people with obesity. So we know that the availability of support and coverage for weight management varies across the country, depends on where you live, really impacts what you have access to. And we know that access to specialist weight management services is limited, and particularly in terms of things that have the most evidence attached to them do not necessarily have the most availability. We know that team-based care is non-existent for the most part, that people are not necessarily getting the support from all the people within a team-based environment that would actually help them to adopt healthier behaviours, for example. And we also know that obesity has not been recognised as a chronic disease by any of the provincial or territorial governments in Canada. And that is really, really worrying because, as Ximena has already mentioned, you know, when none of us have been really even thinking about these things previously, we've been allowing this discrimination essentially to be happening, and nobody's actually been challenging that up until recently. And so some of the work that I've been doing over the last number of years, like Ximena, I have been working in this field for quite some time. And one of my earlier studies at Dalhousie was looking at the issue of obesity management within the provincial system in Nova Scotia. And what I found is really what we've been talking about today, that lack of attention that people with obesity have received, and particularly when we look at it across the perspectives of different stakeholder groups, so individuals who were seeking weight management support, healthcare providers and decision makers were the focus of the research that we conducted here. And what we found through the study, which was done through a collaborative approach with a variety of health professions represented within it, we found that the health system is simply not designed to offer evidence-informed healthcare that is sensitive to the needs of people living with obesity. We have a system where you go to see a family physician with one problem at a time, and often the problems that people with obesity may be facing are more complex than that. What we also found in a more recent paper that was just published last year is that there's a lack of support for the psychosocial aspects of health and well-being, not just for people with obesity. I'm sure we're all aware of this. It's actually something that is there's an issue for chronic diseases more generally. And just to give you some examples of what our participants were talking about, so they really did not feel listened to. And so in this first quote we have, but I didn't get that from the healthcare system. From them I get, stop eating the junk food, or, you know, the blame, or you're not exercising enough, or whatever else. So it's frustrating when they are not really listening. The second quote, there aren't supports for people that are trying to lose weight. I don't know. I mean, those linkages aren't there. And this was specifically relating to the issues of mental and physical health and how they interact and intersect, and how difficult it is to get support for both of those things. And this third quote really kind of, you know, strikes home with me about that blaming language that comes out when we just focus on weight. So, well, what are you doing? What are you doing wrong then? You are not losing any weight. You're gaining. What's going on? And so these are the sort of things that people express to us. And as Ximena has noticed, that prevailing discourse is around blame, a focus on individual behaviour, and a focus on weight as an only important outcome. And this leads me to start to talk about why a focus on health and not weight is needed. Because as that last quote highlighted, weight is an outcome rather than a behaviour. And as such, it's actually very hard to change weight. There are many biological processes that go in place that actually help to defend our bodies from weight loss, and that makes it very, very difficult for people to see to make changes with their weight. And, you know, I couldn't just say to somebody, you know, lose 5 pounds by next week. It simply doesn't work like that. But that's the way that we often frame dialogue around weight management. You know, there's kind of, you must lose weight, you must get to this point. But that really isn't a helpful strategy. What is more helpful is to focus on things like behaviours, because weight is not controllable in that way. But what we can control more is things like what we do in terms of what we eat and what we do in terms of activity. We have more control over our behaviours than we do over weight. And we know that our changing behaviours will impact our health regardless of body weight, shape or size. So on the right here of this image, I've got, I took the image from the Chief Public Health Officer's report that came out again last year, that's really starting to highlight well, not starting to, but continues to highlight the importance of things in our environment, those broader social and environment factors that can help or hinder our health behaviours. And although we've known this for a long, long time, we haven't really seen this kind of permeate into the discourse that surrounds public health, as again Ximena has noted. So, we all have the right to good physical and mental health, but when we focus on individual behaviours too much, then we are ignoring some of those broader broader social factors, environmental factors, the ways that we've constructed our towns and our cities that actually make it very difficult to be physically active, for example, or make it too easy to access energy dense, nutrient poor food options. Those are all the sort of things that we're talking about. And in essence, we've actually made it so that healthy behaviour is abnormal behaviour and the default is unhealthy or less healthy behaviours. And the problem is that we're all exposed to this environment, and you may have heard it described in the past as being an obesogenic environment. I've actually started to not use that term in my work, because that suggests that it's only something that's impacting obesity, whereas actually what we have is a health disrupting environment, an environment that impacts us all regardless of our weight or shape. And when we only think about individual behaviour change, then that makes it an inadequate response to those broader environmental factors. It's essentially like pushing a boulder uphill. It's incredibly hard when all this pressure is pushing it back down again. But we can change the narrative. And that starts with you. And it starts with things like invoking empathy and compassion through those personal narratives. So the work that Ximena has presented, the work that we've been doing here in Nova Scotia, has been really around actually engaging individuals living with obesity and actually enabling them to tell their story. As Ximena mentioned as well, one of the key things that came out of the Weight Bias Summit that was held a couple of years ago is this idea of decoupling weight and health. And I think, I'm a healthcare professional by training, and that's actually very hard for many of us to do because it has been the way that we have been socialised in our training for a number of years. But it's something that is really, really important if we want to be changing the narrative. And we need to be looking more at those supports that start to address those social, ecological and structural determinants of health. Things within our society, the way that we've structured our society, the way that we've structured our health system, and the policies, laws and regulations that influence us. And again, I use a quote there from the World Health Organization, because health is a fundamental human right, and we know that not everybody has access to the same level of health as others based on the things that have already been noted, income, on weight status, all those things are important. So the study I mentioned previously, the blame, shame and lack of support study, produced such rich narratives that we used the data to actually create a short drama that depicts a conversation between an individual living with obesity and their healthcare provider. And so you can see a still from the video there. So we used a bit of poetic license, if you like, to connect the dialogue from healthcare providers and individuals living with obesity. But essentially, we allowed the characters to speak about some of the challenges that we heard. And what we found that was actually a very, very powerful medium for knowledge translation. And so subsequently, we incorporated it into an interprofessional workshop of around about 2 to 3 hours long, depending on the kind of venue that we have. And what we get our participants, so we use, we've run the workshop with healthcare providers and with students who are training within the healthcare professions. And we get the participants to really reflect on what they see in the drama, and then to work together to rewrite the script, to actually change the narrative that is being presented within that, the system that we have currently. What that allows is for participants to see themselves in the solution to the existing challenges that we outline. And that has become a very important tool for seeing that change, for invoking that empathy and compassion, and for then actually having people know and think about things that they can do to improve the situation moving forward. So far, we've had about 1,800 healthcare providers and trainees who've participated in the workshops. So we've actually, begun to sort of develop quite a lot of data around what works and what doesn't work. So here's what we've heard when we look at this workshop in terms of its usefulness in helping our participants to understand the topic of weight bias and stigma. We see around about a 4.5 out of 5 in the scores that we get from our evaluation. When we have think about it in terms of the usefulness of reflecting on weight biases and stereotypes, again around about 4.5 there, 4.4. And it does prove to be useful in future practice, so around 4.6 out of 5 in terms of its usefulness. And we are also beginning to see that that we do see a difference in anti-fat attitudes. So we use a standard test for that, and we're seeing a significant reduction pre and post workshop. So it is making people think, and it is making people change their attitudes. Some of the things that our participants have talked about, here we have a great interactive workshop that I think will help us in future care. We can definitely apply this information in practice. Another says, as a healthcare student, the implications for my own practice have been profound. And actually, the same person also says, as someone who is struggling with weight loss, it was very powerful to hear other people feel and hear the similarities between their thoughts and mine. So again, we're seeing that sort of changing evolution around the narrative that we're wanting to change. And so that takes me on to an approach called Health at Every Size, which has been, again, around for quite a number of years, and really to just highlight some of the work that we've done in this area as well. So a couple of years ago, we published a paper which looked at the Health at Every Size paradigm as an option for reducing the focus on weight. And yes, this is a very promising approach, but we do have to be very mindful of the limitations of the data that we have at the moment, which is that in many of the research that's been done, the sample sizes are quite small. They're predominantly female, white, middle class participants, and we have limited data on people with class 2 or 3 obesity, which are the two kind of fastest growing categories of obesity within Canada, and so there's still a focus on those individual characteristics within the HAES approach that does exclude some of those broader societal environmental factors. For example, one of the things that HAES recommends is this idea of intuitive eating, and that's actually very hard to do when these broader environmental factors are at play. It's again, thinking about that boulder again, it's hard to be the one who has to change the behaviour when everything in the environment is actually modelling the opposite. So we need more research, and we may need to consider that this approach needs some modification to move beyond that individual focus if it's to be meaningful at the kind of public health level. But what should be the role of public health? Well, I pulled a quote from that paper because I think this really speaks to the things that need to be done. Public health does have an important role to play in addressing these broader factors, but this will need us to be thinking about things like the implementation of laws and regulations that mitigate those many environmental factors that impact everybody regardless of weight, shape and size. And so if we want to modify the behaviours and habits of everyone, then we need to be thinking about that and not, there still is a lot of resistance towards, what's seen as, government intervention, the nanny state, those kind of things. So when you hear those sort of words coming out, those are the sort of things that we really need to see greater pushback from people to say, actually, there is a reason why we're doing this. This is an important part of providing that supportive environment for everyone. And so in conclusion, each of you on this webinar has an important role to play in changing the narrative. First of all, you can include those personal narratives that invoke empathy and compassion, because that's such an important part of moving forward and actually reducing weight bias and discrimination. You can be an advocate for policy change that promotes the healthier choice as the easier choice for everyone. You can advocate for things like walking and cycling. You can think about things, again, for looking for healthier food options for people to have access to, limits to advertising, energy dense and nutrient poor foods, all those sort of things. So, actually really being more of a critical consumer, if you like, about some of the messages that we are getting that are not supportive of health for everyone. And again, as a researcher, I spend a lot of my time doing measurement and evaluation, but these are things we also need to do a lot more of within our work environments, because we have a baseline now from the report that was written previously by the Canadian Obesity Network that was published last year. That shows us where we're standing with obesity management across the country. Now's the time to start to measure and evaluate to implement these strategies to shift the focus, to change the narrative, and actually measure the change that it's making. And on that note, I want to thank.
That concludes our webinar for today. Thank you, Dr. Ximena Ramos Salas and Dr. Sara Kirk, for sharing this information, and thank you to all of you for taking the time to join today. For those of you that use social media, you can tweet us using #ObesityTalk, send us a message on Facebook, or click on the survey box in the window on your screen and complete the survey. You may disconnect and close your browser window. We hope you have a great day.